Just because I have symptoms from a nerve compression does not mean I am going to get paralyzed. If you have pain in your legs from a nerve compression in your spine, it doesn't necessarily mean that you're going to get paralyzed, because the motor nerves, the nerves that control your muscles, are in a different location. And it may be the motor nerve is not going to get compressed at all, even though you do have a nerve compression and it's only a sensory nerve. Today's topic is herniated discs, and we are going to look at some very cool images and zoom in on what's going on with the discs and the nerves, and when a disc actually bulges and herniates, how is that impacting the nerve. We're going to be able to see where the disc pushes on the nerve, and talk about the differences between the different kinds of nerve impingement. There are two major types of nerve impingement with the herniated disc. One is a sensory nerve that gets impinged or pressed on by the disc, and that's where you feel symptoms of pain or tingling, numbness. Could be heat, could be cold, burning sensation, electrical, pins and needles, you name it. The nerve can actually feel anything. It could make you feel anything, and it's pretty incredible the wide range of symptoms that you can get from something pressing on a nerve. Now, the other major type of nerve impingement is a motor nerve impingement. And this is not where you feel symptoms, it's where you experience what we call signs. So signs are things like weakness or even paralysis. And there are other types of signs in the body, but with a motor nerve impingement, those are really the two types. So it would be decreased strength or complete inability to use a muscle, which would be paralysis. So that's a much more serious type of nerve impingement. And we're going to look at the difference between the sensory nerves and the motor nerves, where they are, and how a disc could possibly press on them. This is your disc, and you have the two parts of the disc. You have the annulus fibrosus, which is tough material, and then you have the nucleus, the goo on the inside. So you can think about like a fig Newton. The nucleus is like the jelly inside the fig Newton, and the outside of the fig Newton would be the annulus fibrosus. Very tough collagen fibrous material, and it protects the integrity of the disc, of the shock absorption of the disc, which is the nucleus. All of this bone that you see around the disc is anatomy of the vertebrae. And then you have the nerves, which go through the foramen, as we call them, in the vertebrae. And I was talking about motor nerves and sensory nerves before, and so we're going to point them out. When you see the nerves, they come out of the spinal cord here. These are nerve roots. They exit the spinal cord. You have the anterior nerve roots, and these are the sensory nerve roots. These are all sensory nerves here, and they flow closer to the disc, and they join together with the motor nerves, which come out of the posterior side of the spinal cord, and then they form a full nerve. And at this point here, if this was L5, this would be the L5 nerve. Okay, so the significant thing about the anatomy here is that when you have a disc that herniates, for example, like this, or bulges, it's most likely going to press on the sensory nerves before it presses on the motor nerves. The motor nerves are more protected because they are behind the sensory nerves, and it would take a much larger, more significant herniation to press on the motor nerves. This is a really good thing, because sensory nerves don't lead to paralysis, and they don't affect too much of the function in your life. You could have the sensory nerves get pressed on, and they will cause symptoms. They will cause pain or tingling or numbness, but they are not going to cause a muscle to be paralyzed. That's one thing I just find really interesting by knowing the anatomy. It gives me a sense of relief, a peace of mind that just because I have symptoms from a nerve compression does not mean I am going to get paralyzed. They are different nerves and they come out of the spinal cord at completely different places. And so this is a much more common occurrence. I find that really interesting and just comforting mentally if you do get symptoms like that. You're most likely not going to have signs of weakness or paralysis unless it's a really large herniation, like a massive herniation. In paralysis and the muscle is no longer functioning, that is a more serious situation where you would want to go in and see a doctor, get some imaging, and it's probably a situation where you might want to consider getting the herniation of the disc removed so that you can take the pressure off of that motor nerve. But with a sensory nerve compression, it's a little less serious. And the pain might be annoying, the pins and needles, the tingling, that whatever it is, it might be annoying, but it is not detrimental to your function. The only way that it really does affect your function is if it causes numbness in a part of your body. And we do use sensation to, like in our feet, to walk properly and stuff like that. So if you do have numbness in your feet, then it may affect the way that your foot contacts and reacts to the ground, that ground reaction. Or potentially another way it could affect your function is if you stop using your body, stop participating in life because of the symptoms. The solution is still going to be the same. It doesn't really change what you need to do in order to get out of the problem. You need to create more support for your spine so there's less compression and less pressure causing these problems. All of these different diagnoses are symptoms of a spine that needs more support, that needs more muscular balance around it, that needs to be decompressed a little bit. We don't have problems from a spine that is too decompressed, right? The problems are from too much compression and too much pressure, not enough support for the spine. So that's the goal. And luckily that is possible to do through things like your breath and developing muscular balance through a healthy core connection. That's it for today. Thank you all for being here. And until next time, get down on the floor and connect to your core. All right, take care, everyone.